Hi, this is Dr. Vaughan. I am here with Lucy, and Lucy is a patient that has been seeing me for some time now, actually for about 2 months.
Mhm.
And Lucy's going to give us some insight about what we've been working on and how she's feeling. So, Lucy, thank you so much for doing this for us. How are you
Thank
today?
you. I'm doing great. Thank you.
Good. So Lucy, I sort of just did one of the questions I was going to ask. How long have you, well, first of all, how did you find Vaughan Vitality Wellness or Dr. Vaughan, my office?
Yes. I went online and I Googled the best five doctors I don't remember what I had put in there for like my stomach and uh, read down on all the doctors, and then I came across yours, and it sounded more like what I was looking for. And I was looking for holistic. I didn't want to take any drugs or anything like that. And so took a chance, and Susan answered the phone, and then that just kind of confirmed everything she was saying, kind of confirmed like I'd like to take a chance with you.
Okay, good, good. And then, so tell us a little bit about what's been going on, or what you came in with, and what the problems
Okay.
you're having.
Yes. There was quite a few things. I started noticing that I was losing my hair. I was gaining weight, even though I was eating as minimal as possible. Every few days I was gaining weight. I couldn't lose the weight on my stomach. Those were simple things that I could live with, but the main thing was my stomach. I had irritable bowel syndrome, and was having lots of accidents, and they were getting more frequent, and I was scared to go out of the house, especially if I was going someplace that I wasn't familiar with, if they had a restroom. Just would have accidents, and I felt really low self-esteem and embarrassing, and it was scary, and it was getting worse. So those are the main things.
Okay, good. And then, so how long you been working with us or working with me? Like,
So it's been May 22nd. So it's been 8 weeks
okay, good.
since I started the program.
Okay.
Mhm.
And so what have you noticed improvement in, or what changes have you seen?
Oh gosh, the first 2 weeks, I didn't. So even though my main uh, reason for calling was for the irritable bowel movement syndrome,
Mhm.
I was also like wanted to lose weight because I couldn't fit in my clothes, my hair, and all of that. And so after like a week, I didn't really notice that much of a difference. But then suddenly, by the second week, everything started changing. I started losing weight. I started losing inches. Today, I could say that I've lost 10 pounds,
Mhm.
and it's a total of about 17 inches
Wow.
of like my waist, my hips, my thighs, everything. And I couldn't fit into my clothes, and I feel great. And then I don't have any accidents. Before I would go out, and even if I didn't have to go to the restroom, I would make myself go because I had this anxiety. What if? And then, but now I have gone on vacation a little for a few days, went, to the beach, went to the park with my family. Um, I was fine. I think it's because I'm trusting the program now, because it's proved to me that it's working,
Mhm.
that I don't have to have that anxiety anymore. I've been like this for almost 30 years, and every year kept getting worse and worse and worse.
Yeah.
So it's huge. My whole life has changed. So thank you very, very much. It's been great. The food is different. I've had to change how I eat.
Yeah.
Um, and when I have gone back and kind of cheated.
Uh-huh.
I noticed my stomach, I'd have an accident, but it wasn't as bad as before. It was doable.
Right.
And so that has helped me to want to stay. It's worth it. It's worth it. Everything you're teaching me, changing my food, everything, it's a little hard, but the outcome of it is, it's all worth it. I sit with my family. I'm Hispanic, so it's tortillas and it's beans and it's rice and meat, all of this stuff. And so honestly, if I keep up, if I stay with the program, eat like you told me to, like breakfast, lunch, dinner, and snacks in between, if my stomach is satisfied, I notice that I don't crave anything that they're eating.
Right.
And I could literally cook for them and sit at the table and eat my food and watch them eat theirs, and I'm okay with it.
Yeah, that's good. And so, Lucy, tell me a little bit about the things that you tried before, because you said this has been going on for 30 years and you've tried many different things. And I'm assuming they maybe worked a little or didn't work at all. So tell me a little bit of the things that you tried before getting to us and getting and seeing the results.
Yes, I've gone to a few of the doctors, some doctors, holistic. They didn't really do anything that you're telling me to do, and they didn't go into depth with the testing, like the blood test, the urine test, the bowel test. They didn't. They touched a little bit on that, so they weren't getting the full picture. And so I think because of that, they weren't. It wasn't really helping. There was a little. I'd see a little change here and there, but overall, I still had anxiety. Overall, I was still having accidents. I was, after, if this didn't work with you, the last thing resort was going and getting acupuncture, thinking maybe I need to change my mind for that anxiety. Yeah. I don't have to do that anymore. You're finding what the root of the problem is. You're fixing it. It's working. And I feel great. And, a couple of times in the beginning, you said, so what's your energy level from 1 to 10? And one point I said, after like a few weeks, I said 12. Right. I just, I get up in the morning and I go until, and it's just me. There's nothing, no vitamins that's making me do this, no tea, no coffee, nothing. I'm just all energy.
That's great.
I feel great. I feel great.
That's great. So what would you say to someone that is thinking about calling and scheduling or starting a program or starting to work with me? I know a lot of times people have, concerns and I think you did even in the beginning, because it is time and money. And so what would you say to them?
Honestly, and I've heard other interviews with other doctors and people and stuff like that on the internet and stuff. Yeah. And so it's funny that now that I'm being asked that question, but honestly, I would take a chance. You have nothing to lose, and you'll see a huge difference. It's a huge difference, and your whole life will change. You will. This is all different, and I didn't know what else to do. Yeah. If this didn't work, honestly, I didn't know what to do. My family kept saying, you need to go to like a medical doctor, and I didn't want to, because I knew that they would put me on drugs for things, and I wanted to find out, there must be a reason why this is happening. And you found that out by your expertise, by the tests and everything. So I would, if anybody calls you, I would say, please take the chance. You'll be very surprised. I'm surprised that this works after 30 years.